Okay, so May 14th, 1796, it was an important day in the history of medicine. So if it is a live class, I think I could have asked you to identify the person or the occasion or whatever. But since it may not be that easy in this setup, I think we'll just go to the answer first step. This is none other than Dr. Edward Jenner, Dr. Edward Jenner, and he was doing the vaccination for smallpox. Is using the cowpox. It was a very landmark event in the history of medicine and especially in the history of immunization and vaccination. A very important development, and things that actually the medical community actually developed further from that, and then you all know smallpox has been eradicated after that. But if you just look at the ethical aspect of that event, then if you consider the present day ethical standards, we will rather be appalled or shocked by the way in which this trial was done, or so-called trial was done. No? But we can't, when you look about, think about events in the history 200 years ago, 300 years ago, you cannot be very judgmental. You have to understand the events in the context of those times. So, but if you apply the present standards today, it will be very odd to find that there were very little safety safeguards actually taken care by Dr. Edward Jenner for this experiment. So because based on the history, there were other people also had suggested that, but why this experiment happened was because there was an observation by several people that if smallpox, as you know, was a very deadly disease. It was a very deadly disease till it was eradicated. And but there was an observation by several people that there is another similar milder disease which is seen in people who rear cows, those farmers or those people who bring up cows, cattle, etc. And what these people are likely to get, sometimes they used to get a milder type of disease called cowpox, which is not very serious disease. Usually some skin lesions are there, very minimal systemic involvement will be there. Sometimes there will be some pain of the affected area. So minimal symptoms only, not at all life-threatening, self-limiting also. So what the observation was that those people who had cowpox earlier, who had developed cowpox earlier, if they developed smallpox at a later period in their life, the smallpox tended to be mild and not life-threatening. So then people thought, this was even before any bacteria or even viruses was identified. This was an observation. And based on that, many people had postulated that there is something in cowpox that will reduce the severity of smallpox if it occurs later. So then Edward Jenner took upon himself to get some serum or exudate from lesions of cowpox. These lesions usually develop on the fingers and hands, etc. And what he did was he separated some serum from this pus or serum from that skin lesions and injected it to a patient. It was a child, actually, 8-year-old boy, and who hadn't had any cowpox or who hadn't developed smallpox earlier. So probably a person who has no immunity to any of these things. And he injected it in a crude form. And then you just imagine what he did. So after a few weeks, I think 6 weeks or so, what he did was he injected the smallpox lesion, the exudate from smallpox lesion from another person to this child as a test. And then look for whether this child will develop smallpox or not. And this particular child did not develop any smallpox. And this went on to prove that the smallpox, the exudate from cowpox was effective in preventing smallpox. So that was a success of Edward Jenner. But will any one of us be ready to do such a thing by ourselves if we are physicians, or will we allow ourselves if we are a person, no, if we are not a non-medical, if we are a non-medical person, a layman, will we allow ourselves to be done like that? Will we allow our children to be inoculated like that? A small, just experimentally smallpox injection to prove that it doesn't produce any smallpox later on. And it is also worthwhile remembering that before this successful experiment, this particular experiment, he had tried it even in 2 occasions previously. And in one person, it failed. We don't know why, because this preparation of these things probably are not standardized. That could be the reason. One person subsequently smallpox developed. Another person, I think he died. So this was a third person in which it was tried, and it was a success. And then after that, this technique was refined a little more and more, and then this vaccination came into being. So what I want to bring to you here is not the ethical aspects which were violated in these initial days. But we can't blame them. We can't blame our forefathers of medicine, because all these were considered to be normal in those days. So we can't apply today's standards to those days. And we'll just add one more point about Louis Pasteur also. You all have heard about Louis Pasteur. And he had done a lot of work, not only in rabies, that is rabies vaccination, not only about in that is probably the most famous one, but he had made significant contribution in biology and medicine, anthrax and many other things. He, again, it was a trial and error method by which he developed the rabies vaccination and made it more popular. But one thing, I don't know how many of you know, the seniors maybe will be knowing about it, but the juniors may just know that he was actually not a doctor, he was not a physician, but he did the injection himself. So just imagine, will it be possible in today's world? So will a person, a non-medical person, be allowed to administer injection, whatever injection? It be and even on a new trial, something. So it won't be allowed nowadays, but that happened. So this was the ethical standards or the absence of ethical standards in earlier days. Because if something happened to the child, who will be responsible? So even not being a doctor, Louis Pasteur carried on, and because it was a success, and he is now considered as a hero in medicine, and rightly so. I'm not telling it is wrong. But what I wanted to highlight was there were no ethical guidelines on those days, earlier days. There was no question of consent. The persons were not informed about what is going to happen. If everything was informed, we don't know whether people would have allowed such experimental things to be carried out on their own body or on their children's body. And there were no safeguards, no trial, and no check whether the person who is doing the experiment was qualified to do the experiment. Now we just go to the history of medicine a little more closer. This is in the 20th century period. So you know what was the condition of Germany in 1930 to 1945. I don't think I have to elaborate on the situation in Germany on those days. And there were many horrible things that happened during that period. But from medical point of view, one remarkable thing was that there was a lot of progress. I am underlining the point. There was a lot of progress in medical sciences research during those days. So many of the theories in physiology, the other basic sciences, pathology were developed in those periods. And the German physicians and researchers were considered to be the topmost in the research on those days, because they discovered many new things, and many things that we learn now in our textbooks actually were their contribution. So what do you say about it? It's very good, So we should always be very happy, and we should congratulate those researchers. I'm not telling about the administrators on those days, but that is what we may think. But there is another side to these things. how did they do this research and how did they develop all these theories can make you, what you say, frozen yourself. You can become chilled because they did it on living human beings. So if they wanted to study the effect of sub-zero temperature on human body that we learn now probably in our books, what they did was tried it on human bodies. And you can actually do many experiments on animals. Even for animal studies also need animal clearance is needed nowadays. But those days, this concept of ethical things were not there. So even it was because if you do it on humans, that is the best that we can get close to the truth easily, because what we see in the mice or in rabbits may be something different from human body. So if you do it on human body, you will get better results, more valid and more reliable results. But for that, what is the price people were paying for that? So people were subjected to freezing conditions, artificially by the researchers, and they evaluate what is happening to their body and assessing. And all sorts of horrible experiments were done on persons. Like they put people under seawater and then see what happens. They simulate situations like that of a high altitude by reducing the pressure in a chamber, and then study the experiment of what happens in high altitude. So all these were done. So this progress to medical science that happened in those days, and actually paradoxically the fruits of which even now we are also benefited from, actually came from very inhuman and horrible experiments that happened during that period, which can never be allowed. If you ask anyone now, it cannot be allowed. So I'm just taking some more examples of many experiments were done physiologically and pathologically about various diseases. Malaria, you inject the parasite and then study the effect, and you get the best results, because it is not like you do it on another animal or anything like that. Hepatitis, all these drug trials were all done, and the effect of the poisonous gases, because they wanted to do it on enemies for biological warfare. All these were done with human volunteers, not volunteers actually, on human beings without any consent. But the interesting thing was that did they do it on all human beings which were available or which were living in Germany during those times? That is where these ethical issues find another dimension, because all these subjects were either Jews or Russians who were enemies of Nazi Germany during those days, Polish people, or wandering people like gypsies who were considered to be, they are better eliminated. They were considered to be like that by the Nazis, or people who are mentally retarded. The German eugenics theory, suggested that these people are better removed from the world to find, to get new, healthy race. So these were all done on this type of people. Selectively they were done, because they can't do it on the people who they think Aryans who are considered to be good by them. So that was not possible. So they did it on that. And finally, after this is the picture of the Nuremberg trial. Now, this is after the Germany was defeated in the Second World War. All these events they were brought to book. These people were brought to book, and all these people, many of them were very famous doctors and physicians who carried out researches, biologists, physiologists, like that. And we may even be studying many of their theories in our books. They were brought for trial, and this Nuremberg trial was many of them were tried, and many of them were given punishment, many for life, and maybe with like that. So there were many were executed following the Nuremberg trial after the Nazi rule was over. This had to be done. And at that time, certain codes were brought into this is perhaps the beginning of the organized way in which medical ethics began in the world. So the concepts like voluntary consent of participating individuals, and you do an experiment on human beings only if we expect benefits, scientific benefits, and also that if the benefits outweigh risk to the people who undergo the experiments. And always you start with animal experiments first and see the safety, etc., before you subject humans for trial. And you have to take measures to avoid suffering for the people who participate in the trial. And we should not, do a lot of damage to the people who should not harm the people who are participating in the trial. And if the person says that no, I can't withstand this, they should be ready to withdraw from the study, and the investigators should be qualified. I think this point probably was violated by US faster and earlier period. And the investigator should see for any harm. Even though you might have read in the news that there was one untoward incident or occurrence with the COVID vaccine, 2 days back, and they stopped the trial. So there was nothing like that on those days. So all these concepts actually started from from Nuremberg. Following the trials, the medical ethics started to begin. But this was not actually this type of problem. Ethical issues or violations were not limited to the Nazi Germany. So don't be under that impression. And there were experiments done by US also in 1945 to 47. And because the nuclear power was considered to be it was new to the world those days. So they wanted to do trial with many of these radioactive substances. And these were all done without any informed consent. And look at this experiment. This was in 60s or 60s in US itself. So here, what they wanted, the researchers wanted to study the absorption of iron and calcium. Probably that's what we learn now. And using radioactive tracers. It's actually the intention is all very good. But where did they do the study? They did the study in a school of children with mental retardation, and this was the product which was used for that study. So this awards was given, and just I think is a little big slide, busy slide, but I think I wanted to do it like that. It's a letter given by the people who do the research to the parents of these children, and just quoting the important lines in that. So with the purposes of helping, so some sort of consent is supposed to be taken now here, but look at the type of consent that they are doing. With purposes of helping to improve the nutrition of our children and to help them in general more efficiently than before. That's why we are doing this, we are giving this product. And it is also for checking up of the children. We occasionally take some blood samples, which will then be analyzed. The blood samples are taken after one test meal, which was shown in the previous slide, which consists of a special breakfast meal containing certain amount of calcium. Okay, not mentioned that it contains radioactive isotopes. Your son has agreed to volunteer because the boys who belong to the science club to which this is administered have many additional privileges. They get 1 quart of milk daily during that time and are taken to a baseball game, to the beach and to some outside dinners, and they enjoy it greatly. We will analyze it in the next slide. I hope that you have no objection that your son is voluntarily participating in this study. Sincerely yours, the sign of the researcher. Okay, this is a letter by which these information, consent, and everything taken rolled into one. Now, if you analyze that letter, what are the things that become evident to you? There's an obvious amount of misinformation. There is some information is given, but the fact that it is a trial using radioactive isotopes is very beautifully concealed in very nice, attractive language. So hiding of information, and there's a forced consent. It is here. There seems that it's all implied. You will be given like this, and the children will be given like this, and there is inducements, inducement that they will be taken to a baseball game, they will get extra milk, etc. And by this, they force the parents to agree with that. So these are all ethical violations. Now, take some other examples. In 1963, what happened in the study for cancers? The cancer cells were injected into debilitated elderly patients to see if they would immunologically reject the cells. The intention is good to get scientific knowledge, but the method is highly objectionable. And as early as 1972, so just 50 years ago, to study the natural history of hepatitis. So in spite of the Nuremberg Code being there, these things used to happen. That's the point I wanted to highlight. So what happened again in an institution for mentally defective children, hepatitis was inoculated. And there is a very notorious study which is somewhat related to my own areas of specialization. This is a very notorious study called Tuskegee. Tuskegee is a name of a place somewhere in the US, near Alabama or anything, something like that. And what they wanted to study was to study the natural history of syphilis. Natural history means history of what happens to an infected individual if they are not treated. That is the natural history. What will happen to them? And this is a very long study. It's a very informative study about natural history because we get a lot of information from this. Even we teach our students about syphilis based on the findings of this study. And what they did was they had a cohort or a group of patients with syphilis who were under treatment in a government setup. And they were treated with placebos. Placebos means they know it is not going to be effective therapy. They were just told that we are giving something like that. That's all. So that is like the active medication, but whichever was available those days was not given. Now, why this is important? Because even before the penicillin is actually the drug of choice in syphilis. Even now, it's a drug of choice. And that was discovered in 1946, and that began to be widely used from 1950s. Okay. But in spite of this being available, these people, because the study spanned up to 1962, etc., like that. So even after this penicillin was available and the patients used to be treated and cured with that, this group of people were never given that, because if you give that drug, the natural history cannot be studied. So they were denied. They were continued with placebos. And even before penicillin was available, there were medicines which are available at that time, which was not as effective as penicillin, but non-antibiotic therapy like mercury, arsenic, all were used for treatment. They were partially effective. They are not very safe considering present standards, but they were used. But they were not given even before penicillin, and the patients were given only placebos. The interesting thing, again, as I mentioned about the Nazis, like the racial, prejudice. Here, all patients were blacks, so only blacks were studied in the study, and the natural history of syphilis was beautifully identified. And 1997, the then US President Bill Clinton actually made a public apology for this horrible violation of human rights, and officially stated that what was done cannot be undone. But we can end the silence. We can stop turning our heads away and finally say what the US government, because it was done in a public hospital, it was shameful, and I am sorry for that. So this type of events actually led on to more consolidation of the ethical guidelines. And the Helsinki Declaration, I told about the Nuremberg Code, which was rather primitive or very preliminary. And from that, Helsinki Declaration became a little more developed. It was done by the so-called World Medical Association of those days. and stated that the research combined with clinical care should be there because people should be cared. And non-therapeutic research was also defined, how it can be done. So all these were defined. And this was subsequently renewed or revised in 1975 up to 1996. And this forms the basis for good clinical practices during research nowadays. So the issues addressed by this Helsinki Declaration is that research with humans should be based on the results from lab or animal experimentation. So no direct trial with humans. Only lab and animal, and then followed by human. Research protocols should be reviewed by an independent committee because you cannot be the the investigator and the judge and the jury and referee, everyone rolled into together, because then what will happen is that we may try to violate this parameters. There should be an independent authority to judge whether what the researcher is doing is ethical or correct. An informed consent is mandatory, and research should be conducted by medically or scientifically qualified individuals. This is very important, and I think we have to make a special note of it. It's not that anyone can do anything. So all this, how does it apply to the current times? I think I am not going to that type of discussion in this forum, but I think it is something worth pondering. And the risk should be less than the benefits, or to even to the participants. You can't tell that the benefit is to the mankind, risk is only to a few people, let them suffer the risk. You cannot make a decision like that. For the participant also, the benefits should be outweighing the risk, or they should be agreeing to that actually, totally without any coercion or inducement. And again, there are other reports. I'm not going to details. There's other reports actually in this context. Belmont report, just to let you know about the various landmark developments. There is another called in International Ethical Guidelines for Biomedical Research involving human subjects. And then please remember that there is something similar for animals also. Animal to prevent cruelty against animals. There is animal ethical standards are also defined. It's not only humans that we are protecting. And having given this much of a historical perspective into the development of ethics in research, let us now go to some of the main concepts. I think I will try to be as brief as possible here. And there are, actually it is very simple. Very simple. You don't only think you don't have to complicate it yourself, and only you should learn it by principles. You should imbibe these principles yourself. Then it won't be very difficult. One is the autonomy of the participant. You have to respect the autonomy. You have to respect the right of the person or the participant to decide for themselves to participate in the study or not. Very important. You cannot force it. Just because they come and attend the hospital and it is easy for you to get your patients for study, that doesn't mean that they come to the hospital for treatment, not for being part of a study. So their coming to the hospital doesn't imply that they are ready to participate in any study that you plan to undertake. So that is very, very important. You cannot have a decision on them. So this is an area which the beginners find a little difficult to understand. But if you have a real concern for the highest human rights, actually, then it is not very difficult to understand. And secondly, beneficiaries. These terms actually derived from Hippocrates actually. All these concepts are that old actually. Beneficiaries, to act always in the best interest of the participant. Non-maleficents, again, do as little harm as possible to the participant, because any trial, there may be some categorized or untoward harm can be there. That's why we will do a trial. But the patient should be really agreeing to it, and you should also ensure that harm is not very severe. There should be safeguards to do that. And there should be, you should see that there's justice. And it has to be fair to all. And this justice is, our previous experiments that we mentioned, like the syphilis Tuskegee study, probably all of these were violated. and including the justice, because they select only certain races. So it's totally a racially unjust type of study. All other principles were also violated in those studies. Now, a few more concepts about autonomy. That means respect for persons. Very easy to understand. That means you have to respect the individual difference in choices. You cannot assume that that person, no, he has only a mild disease, so he may be agreeing to it. You can't make a decision. You have to leave it to the person. When he need not give you an explanation why he doesn't agree to be a participant. He has every right. Just 1 minute. Hello. I am meeting. Hello, sorry. Now, respect for cultural attributes, because there are different people from different cultural backgrounds may have different values. So their decisions may be based on that. We have to respect that. And never exploit dependency. Very important for physicians when they become researchers. The patients are dependent to some extent, variable extent to the doctors. They may be in the ICU or they may be in anywhere in the OPD. They may be dependent on you for treatment. And that doesn't mean that we have a right to control them and to decide on what is right for them all the time. And actually, these are all actually true even not to research, even to medical practice also, these are important. But more so for research. And the children and elderly and patients under tension are much more vulnerable because they may not be able to voice their opinions under the power structures that we have. And so that we have to understand when you think about autonomy. And one way to decide that autonomy is respected is by giving an informed consent, and consent has to be really informed. It has to be clear in everything. It should not be just a standard, write-up that I agree to whatever study plan by so and so. It's not an informed consent because there is no information there. You have to give proper information. In very detailed studies or little more complex studies, you have to give a proper information sheet. And it can run it in many trials. This information sheet can run into 10 or 20 pages, etc. like that. And it has to allow the person to have an informed decision making. And balance of risk and benefits should be clearly explained. Should not suppress the facts like we did that in that calcium radioactive study. And there should be full freedom to withdraw from the study, even before participating and even after starting. Somebody says, okay, this is not, I don't want. They did not give you an explanation. They have a right to withdraw. And provide written documentation. You should have a written documentation for the informed consent. And you can't tell that because the patient can't read it. So I did not take a consent. I only told them cannot be done. There are ways to overcome that. And you have to have another person who can read and understand. You have to explain it to the presence of the participant. And for that, like that, you have to take the consent. So it is not that you can waive that actually in those people. Because illiterate people may be more vulnerable. And maybe even you may have to have proper recording of this, including even video recording may be needed. And you should also assist children and elderly in decision making. And confidentiality is again another important part of this autonomy. And you should ensure that their personal information is never shared. You have to convince them also. You have to tell them how you will ensure that the data collected from you will not be shared with others. You have to convince them, and that has to be written in the consent actually. I am convinced about the confidentiality part, because otherwise there's a problem if this is not done, and if you are not explained to them beforehand, and there cannot be an accusation later on. So you should not get into a trap like that. And you should ensure that there should be beneficiaries. So maximize the potential, because the research has to be rational, or in the sense that it should have a basis by which you do it. It's not that just because I want to do a research, because I want to do a doctorate, I want to get a doctorate, or I want to finish my PG course. This is mandatory. So come whatever may, I have to do a research and I will do it. That is not the way in which you have to approach you. That is partly true, you have to do in some situations. But that doesn't mean that you have to do a particular study to a particular individual, isn't it? And you have to ensure that doing that with that study, with the possible findings of the study, the society is also going to be benefited in some extent. It should be some concept of a common good should come in the question of acceptability of the research. And do no harm, I think, doesn't need any explanation, but it has to be safeguarded. And justice, again, I already told you, and some controversies can actually illustrate that point. And there have been controversies that why certain vaccine research, it's happening in third world. I'm not going to those controversies, but there may be different, there may be pluses and minuses and many things. There may be right things. So I'm not doing any judgment. But there are issues that come about justice. Why it is happening in poorer countries or something like that can be asked. And the research on inmates of hostels, prisons, mental institutions are usually unfair. But there are ways in which this cannot be avoided. Sometimes, if you are that there is a study based on them only, maybe it may have to be done. But then you have to convince your ethical committee that it is done, and the ethical issues are taken care of even in such situation. But generally, if it's possible, if you can do it in another population, do it in another population, because these people are their rights are actually rather limited, and they may not be in a position to say no. So, and how these ethical concerns are taken care of is by a body which is there in every research institution. And even if you are working as a private researcher, you are not attached to any institution, you should get the ethical approval of a nearby ethical institutional review board for your research. So that is otherwise called independent ethics committee, institutional ethics committee. There are different ways in which it is called. They all mean the same. Ethical review board, all these are called, it all means the same. There is a group of people who are interested to ensure that all these wonderful principles are carried out or adhered to in your study. So that is the institutional review board or ethics committee. And the details of that I'm not going to in my presentation. Dr. Biju will be talking about in greater detail. And some of the emerging areas, this may be perhaps not for the first years or second years. This is about newer areas of challenges in which even the best ethical committees find it little difficult to make decisions, whether to agree, not to agree. There are a lot of issues, there cultural, religious beliefs, and what will happen to humankind in future years, eugenics, many issues will come in these some areas. So I'm just marking out these areas for those people who are a little more advanced in the research aspects. And I think with that I wind up my short presentation. I hope
Sir, yes, sir. We have some doubts in the chat box.
Okay, let me see. Let me see whether I can see it. Or can you ask me? I couldn't actually get my screen yet. I think okay, it's coming up. So chat box I can see. Okay, I will. First one is, can you give an example of taking proper informed consent? So informed consent is, you can approach your own research centers or departments where research is being done. You can really see it's in paper. You have to write in black and white, and you have to write the name of the study, and it has to be in local language. I think Dr. Biju will be telling a little more about it. I am sure about it, and it has to be in a language understood by the person. Local language doesn't always mean Malayalam, because it is Malayalam for people who understand Malayalam. But now there are many people who speak many other languages in our state now, isn't it? So if you are enrolling a Bengali person, it has to be in Bengali language, whether you know Bengali or not. So that is to ensure that they are understood and they are agreed. And the name of the study, the researcher, and what does the study entail? What are the risk and benefit, and what are the person can withdraw from the study. It won't affect their treatment if you are doing it in a hospital. Like that will be part of the study. You can see examples from your own departments. It's not difficult. Sir, as UGC, is it possible for us to be part of clinical trial? I would suggest not to start with clinical trial as a UG. No, as a advice from an elder person, because that is too much to so many things are there to be looked into a trial. I think you start with smaller studies and then graduate into trials. Technically, legally, you can be part, means you may not be able to be an investigator in a trial, even as a UG. You can maybe assist a properly qualified investigator or something, maybe in data collection possible. I think that again has to be will depend upon the investigator. I think I have answered that question. If placebo is given to a patient of severe disease like cancer, won't their disease progress? Absolutely, absolutely. You are quite right. I didn't understand the name as I mentioned SNG. Whoever it is absolutely clear. So you don't do a placebo control trial in a person with cancer. Ethically, medical, what is a scientific point of view, if you take only the science part, that can help in advancing science. But that's what these other people did, which we don't approve. Will you allow yourself? The main question regarding ethics, actually, simple question I think you ask. If you are the person undergoing being a participant in a study, will you allow this to yourself? Or if it is to one of your close family members, father, mother, or your child or brother, will you allow something to be done? If the answer is yes, probably there is not much of an ethical issue. But if the answer is not sure, doubtful, then there are ethical issues. Then you find out what are those ethical issues. And unless they are taken care of, it cannot be done. In this particular instance, it's absolutely impossible. You can't give only placebo to cancer patient knowing that it will progress. So it can never be done. I hope I am clear. And should we do ethical clearance before submitting the proposal? Again, absolutely, emphatically, yes. There is no study which can be allowed without an ethical committee clearance. It is not, you are not the person to decide whether my study has ethical issues or not. It has to be an independent committee. It may not have any ethical problems, but that is not for you to decide. That's for the committee to decide. So you should have ethical committee even for doing studies on data of already treated cases. You could take case sheets and you may think it's already treated. No, what is the problem? Still, the ethical committee has to tell that it's data. So ethical issues are not there, and you can do the study. You should have. And without that, it can be even be a legal problem for you. So don't be enthusiasm for doing research. Don't get entangled into legal problems. And it's an ethical issue also, and like that. And even for publication, nowadays, unless you have a proof of your ethical committee clearance, no journal will accept, no good journal will accept it. Okay, so placebo is given to one group and proper treatment to another group are be denied. I think I have answered that question already. So you can't do like that. So there are other ways to design a trial. Many a time the trial of drugs is with a standard drug, whatever is available now. And with that, and there are other designs like crossover trials like that. So there are, and let us not go into all those technical details, but just from the ethical perspective, you just understand that for some disease, if we know there is a treatment is available, you cannot deny it to one group. Knowing that there is a best drug now that is available, you can't deny it just for getting good results for your study. Okay, I think I have answered all questions in the chat box. If So nothing else. I can wind up and I can hand it over to Dr. Biju for her presentation. Is it okay?
Yes, sir. There are a few more questions, but let's see. I will personally message you the questions if it's not answered in Biju ma'am's class also.
Okay. Few more are there. Okay, I didn't see that. Okay. Sorry, I missed it. In what
Okay, sir.
agreement are people ready to participate in the study? Are they benefited through any way? I didn't get that question very clear, but what I understood is that that has to be there in that consent information sheet. So agreement is any what you say. You cannot give inducements for people to participate in studies, but you can actually give some compensation for some damage that they may have, for maybe loss of their work time, etc. That may be accepted by the committee. What are the special points to keep in mind when forming a consent form for people below 18 years but above 18 years? And there are different types of consent. I think I won't be able to elaborate in this forum now. I think it will be available in your research cell. Now, there are categories like that. For children below 12 years, between 12 and 18 years, they are considered minors, but with certain differences. Uh, and it's if you have any doubt, more details are available in the ICMR website in the ethical guidelines. ICMR ethical guidelines is what we can follow as the best standard in our country. So that gives very clear information about all these nuances. So should the participants be offered some kind of incentive? That I already answered. No undue incentive cannot be done, because then you should not reach a position in which they participate in the study for that inducement. That is not ethical. But that's what I mentioned, because if they have to be part of the study and they are losing something, they are losing their job for the day, something like that, and they are staying back, and you can use some refreshments, lunch, etc. That is not an inducement, but that's not should be something like standard only. Not that you will take them to a five-star restaurant for a dinner after that. That may be an inducement. So these are all nuances that your ethical committee has to work out in each study, and they will decide whether it is an inducement or normal compensation. And can we ask the person to be part of research till end in consent, even though it is said that they have the right to walk out in between. So you can, after getting the consent, you can enroll the patient in the study definitely. But in between, if the patient walk out of the study, you have to you have to allow that, of course, and then you have to adjust it for in the analysis. You will have to tell that the study could not, that particular patient dropped out of the study due to whatever reason. And then your analysis has to include that part also. For animal study, what are the ethical issues that arise? There is an animal ethical committee, and you should not be, even for animals, they have rights, and they should not be cruelty to animals should not happen. I don't know many more details about what are the specific clauses in that. I'm not able to answer that straight away, but I just want to highlight there are ethical safeguards even for animals. I think I have covered all of them.
Yes, sir, you have. Thank you so much,
Okay.
sir.
Okay. Okay.
Uh,
So I think
there are-
you can invite Dr. Biju for her presentation.
I hope you can see my presentation.
yes, ma'am. Yes, ma'am, we can see.
Okay. So at the outset, I would like to thank the organizers of Explore for providing me with this opportunity to present before you. So after the talk by Dr. Ashokan, I think the use of an ethics, where all the ethics come into role, is already clear to most of you. So what we would be discussing in the coming 15 to 20 minutes is how the Institutional Ethics Committee functions. So moving on to my presentation, the first commandment of a doctor is primum non nocere, that is, first, do no harm. So any point a doctor has to keep this in mind that Hippocrates has stated that if you don't know, be bold enough to say I don't know. So your prime concern is first do no harm. But what is happening in the medical sector now? The greatest danger the world is facing from health professionals today is the pressure for research. As you can see, many have joined for this symposium on research. So what is happening is all are interested in research, but somewhere along the line, the basic commandment for the doctors, that is primum non nocere, has now become distorted. Now it seems to suggest we can do as much harm as long as it is scientific. We do not do it on purpose. We think that it is scientific and we are not doing any harm. But there are embedded areas where it goes to a non-ethical side. So in every institution that promotes research, you have an institutional ethical committee. So it is because of this, the basic segment of primum non nocere has been distorted. So moving on to our ethics committee. Now, what is an ethics committee? We are just going to go through this presentation by answering certain questions which can crop up into your mind. So what exactly is an ethics committee? As you can see over here, you have a group of people sitting together and writing down notes and chatting. It's not just that much. Ethics committee is a group of individuals who are formally appointed to review and approve the proposed clinical studies. Now, in the process of reviewing these studies, they also ensure that the clinical research is being done in an ethical manner in accordance with national and international rules and regulations. So, this is basically what an ethics committee is. You have a group of individuals who see to it that the research is being done in an ethical manner. Now, what is the purpose of a research committee? As Dr. Ashokan had already mentioned, there were a lot of researchers. You have seen the Tuskegee syphilis study. So, the basic purpose of an ethics committee is to see that safety is being maintained. Safety of whom? The safety of the participants. In what all terms? You protect the participants in the research, that is, you protect the rights of the participant, the safety of the participants, and also the welfare of the participants. So when you ensure that the participants are being protected, what happens is you ensure that it benefits the community also. So basic purpose of an ethics committee is to protect the participants. Now, how does the ethics committee ensure protection? So we were saying that ethics committee has to protect. So the ethics committee looks into the suitability of the investigator. Anybody cannot be an investigator. Is the investigator qualified enough to do that research? So that is why when we have student projects, you always have a guide over there to guide you so that the experience of the guide is being utilized while you are doing it. So the ethics committee sees that the investigator is qualified enough, sees that you have the facilities for that study. Suppose you start off a study and halfway through the study you realize that you don't have the facilities for that. So what happens is you have a tendency to cook up the study. So the beginning of the study, the ethics committee ensures that you have the facilities for that study. The suitability of the materials and methods to be used. So the manner of the study, that is the methodology that you have accepted, is it suitable for the study is being analyzed by the ethics committee. The design of the clinical investigation plan. A lot of people were asking about placebo. If when one segment of the patient is being given placebo, is it right? When you know that if you don't treat, the condition can worsen. So the clinical investigation plan is being investigated in detail by the ethics committee, ensuring that everybody is benefited. That is, the participants are being protected. Method of obtaining informed consent. Now, consent in a research is the most important form. It is not just enough that you obtain consent, you should also be able to document consent. So, ethics committee ensures protection of participants by taking into account of all these 5 segments. So, we said it's a group of people. So, who are the members of an ethics committee? When you have an ethics committee, for example, you have an ethics committee in Jubilee. So in the Jubilee Ethics Committee, it is anywhere in the Ethics Committee, it is not just the doctors who are members of this committee. You have a segment of medical and non-medical people in the Ethics Committee. Now these medical and non-medical people are in such a way that they have qualifications and experience to review and evaluate the medical aspect of the research, the scientific aspect of the research, and also the ethical aspect of the research. So these three aspects are being taken into consideration by this group of people who've come from different segments of the society. So let's see what is the composition of the ethics committee. As you know, any committee should have a chairperson, should have a secretary. So you have a chairperson and secretary. In addition to that, you have medical scientist, you have a clinician, you have a legal person, you have a social scientist, philosopher, and you have a lay person. Now you can see this is a heterogeneous group. It is not just doctors, it is not just scientists. You have a lay person from the community, you have a philosopher, you have a legal person. So I think I'll just take you around to what the role is for each person in this committee. The categories of members, as you can see, it's a heterogeneous group. And you have a scientific group and you have a non-scientific group. But there's something called an unaffiliated group. In an institution, when you form an ethics committee in an institution, it is not that all members of the ethics committee are related to this institution. You have unaffiliated members, means members who have nothing to do with this institution. See, if you have only members who are working under the this management, what happens? The decisions become biased. So what happens over here is, in an ethical group, you always have members who have nothing to do with you. Like our the chairperson. The chairman of this committee is always an unaffiliated member, so that they can give a neutral decisions about the protocols that are being assessed. The scientist member, as you all know, the scientist member reviews the research from a scientific perspective. That is it scientifically correct? And what are the methodologies used over here? Is the research going to be of any benefit to the society? All those aspects from a scientific perspective. You also have that is why you have a clinician and you have a basic scientist in your ethics committee. Now, the clinician provides information regarding any after effects that can come because of your research, or any dangers or any adverse effects that patient might face because of your research. Now, what does the basic scientist do? The basic scientist is basically normally in an ethics committee, we have a person of experience, that is who has an MD pharmacology. They are always taken as a basic scientist over here, so that they can make us aware of, if you're doing a clinical trial with any drugs, they can make us aware about the effects of the drugs and all other adverse effects which a clinician might not be aware. So that is about the scientific group. I think we need to discuss more about why do we need a non-scientific members over here. First, about the lay person. As you can see the picture over here, what you see over here is a baffled participant. You can see the expression on his face is totally confused. While you see the expression on the face of the doctor, very confident doctor who is explaining to the participant about his research. Now this is called an informed consent. Now you can see there are a lot of arrows going in different directions and which is totally confusing the participant. Now a lay person, the role of a lay person in this ethical committee is it gives us a lay person's perspective. That is, the main aim is to safeguard the public interest. The lay person contributes a patient's voice to professional discussions. So imagine an ethics committee which has only doctors and clinicians who can discuss ample things which is not making any sense to a lay person. So the participants in the study should know what is being done to them. So informed consent forms is you don't inform people like this. See, this is a therapy I'm going to give. These are the benefits. These are the harms. These are the risks. That is not how you do. You explain to the patient in their language, in a very simple language, avoiding the medical jargons, so that the participant can understand what is meant by the study, and he can choose whether he wants to be a part of this study or not. Now, like was discussed by Ashokan sir earlier, as he starts the study, the patient realizes that he doesn't want to be a part of the study. He can leave the study whenever he wants. So the lay person in an ethics committee will provide the patient's voice. So he will think from a patient's perspective. And the main role is to review the informed consent form. So in the ethics committee, if a doctor is reviewing the informed consent form, he might find everything normal. But a layperson might find out the flaws in the consent form. He might find out that you haven't used terms which a normal participant can understand. Now, why do you need a legal person in an ethics committee? We know we have an ethics committee where all are trained to do things ethically. But why do you need specifically a legal person? Of course, we need to know the legal person's perspective to ensure the legal rights of the patient is being protected, and also to ensure that ethical committee decisions do not contravene with law. Often we are placed in situations where it might be ethically correct, but it might be legally wrong. For example, let's take the condition of euthanasia. So when you hear about euthanasia, when you have a scenario of euthanasia, when you find that the suffering of the patient is too much, and ethically you feel that euthanasia should be accepted. So the ethics committee might feel that it is ethically correct, but in different countries follow different laws. Still in India, euthanasia is not being accepted. So it is not legally right. So there are situations in which the decisions might be ethically right, but legally wrong. So that is where we need a legal person in our ethics committee who will highlight to us what the present rules and regulations are for our country. Why a social worker? Now, social worker is somebody who works in the community. So his main attention would be to see whether the project that you are submitting is likely to cause any social harm. By social harm, we mean the discrimination or social stigma. Suppose you do a research and you end up coming up with a result that suppose people who live in Thrissur are more prone to COVID. So that is a form of social stigma. So what happens? The people in Thrissur, when they move out, people don't like to interact with you because you are more prone to COVID. So those kind of thing is being dealt by the social worker. They see to it that the project you submit do not end up in creating a social stigma. Harm due to socio-economic vulnerability. There's a lot of research where earlier in our place was planned based on the tribals. So what happens in tribals is they have this vulnerability, socio-economic vulnerability is there. So whenever you plan to do a research in the tribal, it is important that you get a person who works with the tribals, who understands the difficulties of the tribals. So that comes the question of the vulnerable populations. Sorry. So you do research which is culturally acceptable and there is no risk due to social hierarchy. So a social worker in the ethics committee ensures that there is no social harm being created because of your research in terms of whether it is culturally acceptable and the vulnerable population is being taken care of. Now, research involving vulnerable population. Now, who exactly is a vulnerable population? Suppose I plan to conduct a research on my first year students. Now, those first year students are under my control because I am teaching them physiology. So they are forced to listen to me and forced to follow what I am telling them. So they become a vulnerable population, and I am not allowed to conduct research on a vulnerable population. The other groups of vulnerable population is those people who are in the prison, the newborn babies and mentally ill people. They are all vulnerable population. So when you are conducting research on the vulnerable population, in the ethics committee, you need members who are knowledgeable about and experienced in working with the relevant populations. So you have seen the role of the lay person, the role of the legal person, the role of the social worker. Now, in case you are doing a research on certain segments where you don't have expertise, suppose you plan to do research, that is, an investigator plans to do research on genetics, and in our ethics committee, none of us are trained in genetics to give comments on this. So, in these conditions, we can invite non-member experts to assist with the review. Suppose you plan a study on newborn babies, and the clinician in our ethics committee is not confident enough to give comments on newborn babies. So in that case, we can invite non-member experts to assist with the review. So as you can see over here, the ethics committee is not a strict body. You can add up new members as and when required. not as a permanent member, but as an inviting non-member experts. So this is what the ethics committee is. Now, what are the common ethical issues in human experimentation research? That is, whatever research you submit, where are the key focus areas? Recruitment of participants is the first area where a lot of ethical issues crop up. What is the procedure you have adopted to recruit the participant? I could see some doubts over there whether you can give monetary benefits to the participant. That is again highly unethical, giving monetary benefits to the participant. So the procedure adopted of how you are recruiting the participant, it varies according to the different types of studies. So I'm not highlighting about what are the different procedures, whether there are any risks to the subjects. Of course, in any study, there might be some amount of minimal risk to the subjects. But if there are risks to the subjects, have you taken care of what are the precaution measures adopted to deal with the risk? So that is also being taken into consideration when you submit a protocol. The next segment is whether there is voluntary participation. So any study you do not force the participants to enroll into your study. You give them a choice. That is where the principle, the ethical principle of autonomy comes up. You have seen the four basic ethical principles. So when you give them a choice of voluntary participation, there you respect the ethical principle of autonomy. Again, he can withdraw whenever he wants from the study. So there again, you have respected the principle of autonomy. Vulnerable population. So when you are taking into account the vulnerable population, you see to it that you have a person who is giving you consent from their side. We'll be discussing about the consent forms in detail now. Written consent form. So consent form, how do you collect the consent form? You can give a verbal consent or a written consent. It's always important in any research that you collect a written consent form. So somebody was asking the question about people who are below 18. So from 12 to 18 years, you have something called the assent form. Assent form is that you inform the child that this is a type of research that I'm going to do, and you will be involved over here. You are free to say that if you want, you don't want to be part, you are free to say that. So that is called the assent form. You're just informing the child what you're going to do with them. But consent can be taken only after 18 years. So you have an assent form and you have an informed written consent form. So in the case of vulnerable population, like mentally retarded patients, they cannot give a consent. So in those cases, you take consent from their guardians or any person who is legally responsible for those mentally retarded patients. In the case of prisoners also, you have to have consent from the prison in charge, those people, they can give the consent. Confidentiality. So in everywhere, this is a major ethical issue. Confidentiality. You find that in the process of research, you find that one of your patient is suffering from, say, HIV infection. You have to maintain the confidentiality over here. So if there is a breach of confidentiality, there's a breach of ethics over here. So whenever an ethics, where you submit a project, these are the points that the ethics committee takes into consideration. Cultural, social, and gender-based characteristics are taken care of during your research. So as of now, a lot of issues about gender is cropping up. So it's very important that you respect the rules and regulations and the legal basis of your country and plan your decision keeping into account the cultural and social background of your country. A research which is being planned in the Western countries cannot be done in the same way in India or for that matter in Kerala because we have cultural differences. So ethical issues can come up if you do not take into account the cultural aspects of your country. So ethics committee. So we said we have a group of members. We have a heterogeneous group where you have the legal person, the lay person. We have said all that, but they should be trained. They should be well trained in the international and local ethical and legal standards which govern the research. In addition to that, they should also be trained in the processes which are used by ethics committee to review and approve the research protocol. So that is why the members of the ethics committee have regular training in good clinical practice. They also have regular training in the local guidelines and also the international guidelines. As of now, in India, we follow the ICMR guidelines for research. You have a website in the ICMR. There, if you follow the ethical concerns over there, you have an extensive site for the ethics itself. But these ethics committee members should also have good knowledge of the social aspects and the cultural aspects. So you can see these are the major arenas that the ethics committee members deal with. So the main roles we have already said: protection of the human subjects and adherence to ethical values throughout the research. Now, what is the power of the ethics committee? Now, ethics committee, though it may sound very easy to go through the ethics committee, it is a very powerful committee. It has the authority to disapprove the research that you have submitted, to terminate a clinical study which is going on. As you have seen in the case of COVID, the vaccine that is being done, the vaccine has been withdrawn. That can be because the side effect was known by the ethical committee and they have decided to terminate the study. So any study, it might be towards the end stage, the ethics committee has the right to terminate the study based on seeing that the ethical principles are being followed or not. They can also suggest modifications in your study. So you can see any protocol that you submit has to go through ethics committee, not just for you, not just to say that your study is of no value or it's not good. It helps to modify your study. It helps to see to it that your study contributes to the community. So these are the four basic principles of ethics. So if you keep in mind these four basic principles of ethics, I don't think so it would be too much of difficult to submit a protocol which is according to the ethical guidelines. Autonomy, justice, non-maleficence and beneficence. If you keep all these principles in mind, your whatever proposal you submit would be following the ethical guidelines. And most important is, do not forget your first commandment as a doctor, that is the primum non nocere. Thank you.
Thank you, ma'am. Ma'am, we have some questions in the chat box. Ma'am, you mentioned about the Oxford COVID trials, vaccine trials getting cancelled, right?
Yes.
If any, likewise, at our research, at any step, if something like this happens, then what's the next step? Are the researchers supposed to end the whole study?
See, this is called the serious adverse effects. That is, the patient had transverse myelitis in the case of Oxford COVID vaccine. So it is a serious adverse effect. So what is being done in this state is, you come back, you go through what is the cause for this adverse effect, what has caused this adverse effect. Sometimes it might be something isolated, not related to the vaccine. So when you go through the study, what has gone wrong in your study, find out what caused the adverse effects, and if you find that it is not because of the drug that you have used or because of the vaccine that you have used, you can continue, provided you have clear-cut proof that this is not related to your study. Animal studies are being done initially. So sometimes in animal studies, you get clear-cut no adverse effects are there in the animal studies. But in humans, when you transmit it to humans, it can result in adverse effects. Now, if you find that the adverse effect is related to the study is being done, so I think you would have to drop the study, because it is not important that you have done study for a longer time. It is important that you ensure that your participants are safe.
Thank you, ma'am. We have another question too. Bond and ethical committee be subjective?
Aisha, I don't understand your question. What do you mean by subjective? I have already explained, ethical committee is a group of individuals. Nobody alone can take a decision. It's a group of individuals who belong to different strata of the society. So how can you be subjective over there?
Ma'am, I was about to ask that there are different ethical committees existing across India or a particular country. So won't it be subjective? Like, suppose one research may be okay for one ethical committee, but it won't be, or it will be not okay for other ethical committee. I'm not saying about researches which are obviously will cause trouble to the people, but in some borderline cases, I was just asking that.
Uh, I think you're asking like earlier I had mentioned cultural factors, right? Is that what you are
Yeah,
mentioning over here? Cultural factors. So
yeah,
that is why that is the rules and regulations of the country differ. Like
yes, ma'am.
euthanasia, I had given an example. It is still not legally acceptable in India, but there are many countries around the world where it is acceptable. So research over there can be acceptable, but it's not acceptable over here. So this is taking into account of the cultural and social habits of our country. So I don't think so. There's a in Kerala and Tamil Nadu. I don't think so. There'll be major differences. All of India, we follow a set of rules. We stick to that. So I don't think so. There's a question of being more subjective over there.
Okay, ma'am. Thank you so much.
Yes, Jessia, your question is, are medical students allowed to do animal studies, feasibility, and what may be the ethical issue? Of course, why not? Medical students can do animal studies, and you have a separate animal ethics committee over here. The ethical issues related over here is unnecessarily using animals. You use animals, and you like the number of animals that you use for your study and the amount of strain that you put on the animals for research, how you dispose of, that is you see that an animal is in pain and then you continue to see what is the effect of that. Those are all ethical issues related to animal ethics. The manner in which you are going to deliver a drug to the animal, are you hurting the animal beyond a certain limit? Those things are involved in animal ethics. Of course, you can do animal studies, and likewise, like I said earlier, when you are a student, you need a guide to help you out in the animal studies. We have a very well-formed animal house over here. We have a very good animal ethics committee in Jubilee. So, if you are willing, please do come. We are all ready to help you if you are willing to do animal studies. Yes, James. Common mistakes to avoid, common problems in the proposals due to which they are rejected or modified. I have said the common arenas is how you recruit the participants, what is the methodology you have adopted, and what are the steps that you have taken to ensure that the consent forms are clear to the participants. So these are the common areas that you should focus when you are preparing a proposal. Is Anusha, while taking gender data during data collection, should we measure male? Of course, you should mention male, female, and others because now the third gender is being accepted in our country. So you should give a segment to that also. You should respect that it is being accepted in our country and do not put male, female. Whenever I get an application form where there is male, female, other, and there is no others, I just leave it. Not that I belong to the other category. It is just that I respect that that is being acceptable in our country. So that category should be mentioned over there. Yes, Harivardhan, is in case there are
Okay, ma'am.
any harm occurred to any of the participants, don't they have a right to compensation? And if so, does a part of the funding received from the research be kept? Yes, Harivardhan, very good question. Of course, it is like that. That is where you have the ethical issues. In the ethical questionnaire that we submit, you have to mention whether there is any chance of having any harm to the participants. If there is a chance of having any harm, do you see to it that they are adequately compensated for that? So that is a segment. And if it is a funded project, of course, a part of the fund is being allotted for the adverse effects. Any more questions? I don't see any more. Yes, Soumya. In studies which does not involve clinical trials or direct patient interaction, example epidemiological studies, is it necessary to get ethical clearance? Of course, you should go through the ethical committee. See, the ethical committee you should submit the proposal to the ethical committee, and the ethical committee will decide whether this should be exempt from ethics, or it should be reviewed by a full board, or it should be have an expedited review. So, any project that you plan, it is not you who can decide whether it meets ethics or not. You should submit your project to the ethical committee, and the ethical committee will decide. No need of having an extensive ethics discussion for your project. I hope I have answered all your queries.
Yes, ma'am, you have.
Okay, then thank you. Thank you for providing me with this opportunity, and it was a good discussion with you. Thank you very much.